So, hi everyone. Today is a special day because we bring to you the first episode of the video podcast for Brain, Spine and Beyond. And we have a very special guest today whom I want to thank very much to accept my invitation to come as our first guest on this podcast. Without further ado, I would like to welcome Prof. Hutchinson on the podcast. So, Prof, thanks for accepting the invitation. As I was just doing the preparation for the podcast, I was just going through your CV and, trying to figure out what I should talk about. And I figured out that I will keep talking for the 30 minutes that we have. So I'll just mention the most important ones. Prof. Hutch is a world expert in neurosurgery, a very famous academic neurosurgeon. He's currently the president of the Society of British Neurosurgeons. Also, he's the director of clinical research of the Royal College of Surgeons in England, and definitely a consultant neurosurgeon in Cambridge, with a focus and special interest in neurotrauma, with hundreds and hundreds of publications and over 25 million in grants for different research projects. And also one interesting title that we'll probably talk about is being the Chief Medical Officer for the Formula One, the British Virgin Grand Prix. So, Prof, thanks again for coming. And I'll probably start from the end, which is your last appointment as the SBNS president. And my question to you is probably what the top three things that you think that you would like to achieve as an SBNS president. And after that, what you think are the top three obstacles that you see the neurosurgical community in the UK is facing. And if you can, kind of reflect on that on a global level as well.
Yeah, sure. Well, thank you so much for asking me to the first podcast. It's a real privilege and honor. So thank you for that. So as you said, I've been very fortunate and the support of colleagues in being appointed the president of the Society of British Neurological Surgeons. I took that over in September at the meeting in Birmingham. That's a 2-year term. And I've actually set out about, there's 12 important topics that the SBNS are currently addressing. And it's important that we deliver all of those. I'll just mention perhaps three. The SBNS, as well as the president, has 2 vice presidents, and one of whom is Nigel Mendoza, and he's carrying on the really important global work that we're doing. Yeah. The SBNS has got very engaged in global neurosurgery across particularly low middle income countries. 90% of head injuries are occurring in these countries, and we need to do a lot more. So beyond neurotrauma, other neurosurgical pathologies as well. So we're looking at fellowship programs, the bursaries, and the ways that we can continue to engage. As you know, I do have an academic background, and our second vice president is Professor Michael Jenks from Liverpool. He's currently chair of the academic committee, and he's done a tremendous job in promoting basic translational and clinical research in neurosurgery. What we're really interested in is taking that to the next level in terms of 2 things. The first is impact. I think British neurosurgery has done well. We've punched above our weight in terms of academic outputs and publications, particularly of the trials. But what we need to do is ensure that that actually results in impact. What do we mean by that? Are the results getting into guidelines? Are those guidelines being followed? And is that changing practice and improving outcome for patients? So we're really consciously looking at the impact of the trials at the moment, and that's something that Jenks is doing with the academic committee. And then neurosurgeons are innovators. We all have new ideas. We have ideas about devices. We have ideas about new technologies. We have ideas about new operations or how we may do operations. And that can be quite difficult to navigate. So we're also looking at ways by which we can make that easier, how neurosurgeons can come up with their ideas, whether it's devices, how we do surgery, do the studies to show safety and efficacy, but then how do we actually get this into practice? So we're calling this the concept of future of neurosurgery, and that's something that we're also looking at. So those are a couple of things to get going. I mean, the other big thing that I'm very fortunate during my presidency is, of course, it's the 100th anniversary of the BNS in 2026. So we're going to be arranging a large meeting in London at that time. But beyond that, there's some really important other initiatives. There's the training and workforce planning, equality, diversity, inclusivity initiatives. There's the issues in relation to NHS commissioning, low volume, high complexity, the National Neurosurgery Audit Programme. So there's many different initiatives across the portfolio that are important.
Sounds like a lot of work that you have to go through, and hopefully,
the SPNS is amazing. We have a fantastic secretariat, Suzanne Murray, Alex Gordon, Carol Turner. We have a fantastic executive committee. Past President Peter Whitfield, we have Jenks, we have Sam Hettigy, who's the meeting secretary, we have Nigel Mendoza, Surajit Basu, our treasurer, and it's a great exec, and of course Peter Whitfield, my predecessor, and then we have the council who are driving a lot of these initiatives forward. So we're very fortunate.
Yeah, and I will just pick one part that you're talking about in terms of the neurosurgical innovation. Do you think that what's the difference you think between like the US and the UK in that aspect, and how can we kind of improve our ability to transform those innovations into things that can actually that we have technology in the market? How can we bridge that gap, and what needs to be done?
I think if you perhaps look at that in terms of devices, we are fortunate in the UK that we can develop a device and have single use approval within one NHS institution, providing it's approved by an ethics committee and local R&D and clinical engineering. So I think that mechanism is there to pilot devices within hospital. I think the challenge is when we're trying to spin this out into other trusts in the UK and beyond, and the CE mark or in Europe, there will be equivalent legislation in the UK that's coming. And also the FDA in the US has got increasingly challenging. So I think that's something we're going to have to learn to navigate.
I'll probably go back to the very early start as being a neurosurgeon. And probably the question is, what actually inspired you to be a neurosurgeon? Why not like something else, like a surgeon of any other craft, or maybe a physician, or maybe another job, not being a doctor at all?
Well, I think medicine's an amazing vocation and career. I think we're all very privileged to do that. Why neurosurgery? I think I have a passion for both parts of the word, I guess. From my days of anatomy when I was a medical student at Barts Hospital, it was my favourite subject by a long way. And I particularly, the head, neck and neuroanatomy was by far the most interesting part of the anatomy. The other parts of the body are great, but if you're being a little bit unkind, you could argue that they're the life support organs for the brain, and the brain is what makes us different and what we are. So that's a fascination I've had a long time. And of course, neurology was one possibility, but I think beyond that, neurosurgery, and it's changed a lot, even in the 30 years that I've been in it, is an amazing specialty. The breadth of the pathology we treat, the interventions that we can employ, non-surgical and particularly some of the surgical interventions across all the subspecialties. And I've seen changes. Neurosurgery is changing, and I think the surgery that we undertake has changed and will continue to change into the future. And this is why these innovation projects are really, really important.
And have you had any moment, like when you get like those difficult moments in your career and you think, that was the most stupid decision that I have ever made, like being a doctor or being a nurse? Have you come across this point at any point in your career?
No, I don't think we can hide away from the fact that these jobs are difficult. And I think the challenge is to try, particularly in academic neurosurgery, is get all these balls in the air and keep them there. Yeah. So I think the challenge is, I see life as 4 domains in terms of career. Mm-hmm. There's your clinical practice is absolutely paramount. Fundamentally, we are doctors, we are surgeons, and we need to be delivering that at a very high level. Secondly, for me, education and training is really, really important, particularly on the academic side, to bring the next generation through. Leadership beyond that, but then research is critical. As you know, that's been my passion. But I think beyond that, administration and just leadership is so important. And And I think the challenge is how you juggle all this and keep everything together.
Probably, I mean, during your career, you have been through like difficult moments, not from a career point of view, but like, difficult patients or difficult situations. And probably all of us as surgeons or neurosurgeons, you remember like this heartbreaking moment or patient that it always kind of sticks in your head. So what's that heartbreaking
Yeah,
moment
I can tell you a few of those. I mean, let's think of an example. So, as you know, training now is very different. Everybody wants it consultant delivered, and that's how people want it. And if you look at the efficiency of operating, that is probably good. But if we do that, then we're not going to train people. And if you look at the way perhaps logbooks may evolve, a lot of surgery may be with a consultant supervising a trainee. But I think it's really important that the trainee actually gets a lot of exposure operating by themselves, particularly when they get more senior, with a consultant appropriately available. So I can take you back to one early Saturday morning when I'd just been appointed as a consultant, and there was a difficult patient came in with a very large vascular parasagittal meningioma, actually involving the sinus, and the patient was decompensating, and we embarked on that on the Saturday morning. And it was a difficult operation, and at one point it was not going well. There was a fair amount of issues, particularly in relation to hemostasis. And at that moment, I thought, "Oh, this is quite interesting. It's time to call the consultant." And then it sort of suddenly occurred to me that I am the consultant, and you sort of you get over that, and you just push on with the operation, get hemostasis, and all went well. But I did reflect on that, and I thought, well, I am the consultant, but I had done enough surgery myself independently to know how to deal with that situation. I worry that if all training in surgery is done with somebody else being scrubbed with you, then you may not get to that point of independence. Having said that, I think that there are ways around this, and I suspect what's going to happen in the future is more dual consultant operating. Makes a lot of sense to me. Senior, junior consultants, two surgeons operating has to be the way forwards. Particularly is if you look at the volume of cases, there has been quite a big expansion in the consultant numbers within neurosurgery. There's not been a huge expansion in the number of operations. The consequence of that is that we're doing less surgery. I think doing it together in some sort of senior junior mentorship role is a very sensible way forward.
I will jump to you won the, I'll probably pronounce it right, Olive Krona Prize, which is basically for people who don't know about it, is basically, it's called the Nobel Prize for Neurosurgery. How's your feeling about it? I mean, it kind of having and winning this kind of prestigious award.
It's not really a Nobel Prize, but it's a really nice recognition. I think it's a prestigious neurosurgery prize that's awarded by the Scandinavians, and with a very nice lecture and presentation that you give in the Nobel Forum at the Karolinska in Stockholm. So it was a great privilege to get that. I had a very nice trip to Sweden, and they did a really good day. It was about microdialysis. It was about brain metabolism and brain chemistry monitoring. They put on a whole day with my good friend and colleague, Professor Urban Ungerstedt, who I think is the father of microdialysis. It was a really good day. And I think what we try to get across is a lot of these monitoring techniques in intensive care, we've done a lot with intracranial pressure, brain tissue oxygen monitoring, microdialysis is actually, there's no doubt they've increased our understanding of the pathophysiology, but we need to be very critical about actually applying these techniques to benefit patients individually in the NHS.
As we said earlier, I mean, you are the chief medical officer for Formula One, and not every neurosurgeon is a chief medical officer for Formula One. So I'm just curious about what does that mean? I mean, what do you actually do? I mean, before, after, during the event? Do you have to be in the event itself?
Yeah. So to be clear, I mean, I'm the Formula One medical cover is slightly complicated. There is a Formula One medical delegate who's the overall rescue doctor, and that is a good friend, Ian Roberts. It used to be Sid Watkins, a neurosurgeon. It's currently Ian Roberts, and he attends every Grand Prix. There's 24 on the calendar this year. So him or one of his deputies or colleagues attends all the races. My role is that I'm the Chief Medical Officer for the British Grand Prix. So as well as Ian overseeing all this, each of the 24 races has its own national Chief Medical Officer. And that's quite important because I'm registered to practice in the United Kingdom. So there'll be an equivalent in each of the countries. And my role is, at the moment, it's largely organisational, particularly in the preparation. So I lead the medical team of about 100 members now for what is a 4-day event in July in Silverstone Circuit, which is the home of the British Grand Prix in Northamptonshire. So it involves getting the team together and then arranging a very safe event for both drivers, officials and the spectators. There's over 400,000 people at the event. We have the medical team has a component that looks after the drivers in the event of an accident, but so much of what we do is providing medical care for the public over that weekend. So it's quite a busy time. We see around 1,000 patients altogether in the medical centre. And then for the doctors, we have a responsibility to provide very urgent care if needed. And it's really interesting. So we, not only in the Grand Prix, but we've seen a lot of head injuries in motorsport that are very pure. What do I mean by that? This is brain injury, but because you have medical intervention within 90 seconds, this is brain injury without hypoxia and hypotension. So it's actually a very important research questions. You can actually dissect out the secondary insults. I can't think of any other situation where medical intervention is so rapid after such a severe brain injury. So that's something that we're currently looking at.
That's quite interesting. I never thought about it in that way. But it's actually a good time to study this part. We'll probably talk about the leadership rules. And my question is, you have been in so many leadership positions, and probably a lot of the surgeons or neurosurgeons would think, is it actually worth it? Do you think that I'm a surgeon or a neurosurgeon, do I have to be a leader? Or what do I get from in being involved in the SPNS, let's say, for example, or ENS or whatever organization, because that takes a lot of time and effort as part of your career. So what's your take on that?
So my take on that is that you're a doctor for quite a long proportion of your life and you're a consultant for 30 years. It may well be longer going forwards. And I think it's really important. It's quite a long period of time is to try and change the emphasis on what you do over that time. So I've always seen life in 5-year epochs, particularly since becoming a consultant. So when you start, what's really important is to establish yourself in your own hospital, your own practice, looking after patients, a lot of clinical work, getting that under the belt and really getting yourself up there and recognized as a superb doctor and a surgeon. That's what, that's our core goal. But I think once you go beyond that, then you can begin to look at other aspects of career. And that may be related to education training. It may be related to a career in research. It may be leadership. And that can be both within hospitals, so working your way up through the NHS clinical leadership, or nationally, in the SPNS is an example of that. So I would encourage people to do it, but try and look at these 5-year blocks and how you can change your emphasis. I think it keeps your interest, it keeps you going. I think to do the same thing without any change over 30 years, people perhaps get a little bit stale. It's a bit tedious. So keep new ideas, keep changing.
What's the most difficult leadership position that you have been, like a conflict or a situation that you have seen as a surgical leader? And how did you handle that?
I think we're quite lucky on the whole. Occasionally you see conflicts between colleagues, particularly colleagues with other specialties, and that has to be sympathetically managed, both in terms of direct interaction with them and their seniors. But these things can be solved, and for me, it's about talking to people and just trying to resolve situations. So I mean, there are it happens in medicine, but on the whole, I think if people are sensible, most people want to try and resolve these situations. There are ways around them.
It's always the communication is the most important part of it, isn't it?
Yeah, we're very fortunate in Cambridge Neurosurgery. We're a bunch of consultants, trainees that get on. But how do we do that? We have a meeting at 8:30 every Monday morning of the consultant body. Sometimes you wonder what's actually achieved, and there is some business planning and some decisions to be made. But I think what's really valuable is that we're all in the room together, chatting away. And during COVID, that was online, which sort of worked, but there's nothing quite the same as being in the same room as your colleagues and chatting about what happened at the weekend, what the plans are for the week, and just everybody being together is so important.
If I would ask you about the kind of top 3 lines of advice that you can give to aspiring neurosurgeons, the top 3 things.
So the first thing is to make sure that you get a really good training, particularly in terms of your clinical training, and go out, do a fellowship, get yourself really skilled up in one specialty, and make sure you're become an excellent surgeon. I think that's the first thing I would say. And choose your specialty carefully. Neurosurgery is changing, and the emphasis in specialties is changing. So you need to think about that. The second thing is to make sure that you have lots of different facets to life. So I've talked about in the early years really focusing on your clinical training, but develop these other interests. And you don't need to do everything, but whether it's education, training, leadership, research, pick one or potentially 2 of them, and really go for that. In terms of what you want to do. And the third thing is we're all driven, we're all fascinated in neurosurgery. It's our thing, but try and maintain or develop other interests outside neurosurgery and outside medicine. We're not neurosurgeons forever. So I think outside interests and family relationships are critical. Very fortunate with that, as are many others. So just be aware that it's not the only thing in life. And I think when people approach retirement, it's really interesting. And I've got different colleagues who've done that and how they approach that. And so just develop other interests outside medicine that take you through to the next stage of your life beyond retirement.
Good. And given that you have so busy schedule, what's the 3 tools or strategies or things that you do to manage your time effectively?
I mean, so how do you do that? So I think you have to be really organized. And for me, it's about structuring the week. Is important. So that's the first thing. I'm fortunate in my clinical practice is loaded towards the beginning of the week. So I tend to do my clinics on calls, theatre Monday, Tuesday, and then my role at the college is more midweek, and then perhaps research and some other meetings at the end of the week. So get that really structured and get yourself organised. The second thing is to work with colleagues, and particularly the juniors. You can do a tremendous amount in terms of team working. And getting people to work together can be really, really powerful. And we've got, we're lucky in British Neurosurgery. There's some amazing trainees who can assist with projects, and if you can do that, productivity and efficiency is so much better. Those are a couple of pointers. Yeah.
And I'll probably just finish with a kind of funny question. I'll give you 2 options for each question, and you just choose one. So would you choose football or Formula One?
I'm a great fan of Formula One and making it. We do a lot beyond the Silverstone in terms of sports concussion, motorsport, rugby, football. So I think I would say that I'm really passionate about all sport, and particularly making all sports safer. I won't tell you which football team I support because everybody will be.
Good. And would you rather do a surgery in space or surgery underwater?
Oh, that's an easy question. I think surgery in space. You think the opportunities. We're global at the moment, but we need to go super global, and that would be amazing.
If you would master one skill, what would it be? Playing piano or speaking multiple languages?
I think I would like to speak multiple languages. I've been really lucky with academic neurosurgery and traveling around the world, and to be able to speak more languages. And I try and learn a little bit wherever I am. I speak poor French when particularly on holiday, but no, wouldn't that be amazing to be able to speak several languages?
And would you rather do an extradural hematoma operation or an acute subdural hematoma? I just choose both of them are trauma, so
it's trauma craniotomy, isn't it? So I'm happy with either of those. But what I think we've been fortunate with those trials is trying to guide people in terms of decision making. So the rescue acute subdural and what you do with the bone flap and the indications for decompressive craniectomy.
And I was reading and I found out that you love classic cars. So do you have any, or how many do you have? Or
I do have a passion for old cars. Yes, I do. I have a 19. Well, I've got a very old British sports car called an MGA, 1957. So that's quite an old car. But the challenge, of course, is having time to spend with these things. But that's why you need these other things beyond neurosurgery for something to do later in life. Yeah, cool.
My last question: leaving kind of a legacy is something that all of us would aspire for. If you would say in one line, what would you like to be remembered for in the field of neurosurgery?
Okay, so that's a really good question, and I think one of the traps we can get into is perhaps try and do too much. But what I'd like to be remembered for is really developing academic neurosurgery, particularly translational and clinical research, to the benefit of patients, but also developing that field and bringing trainees and younger consultant colleagues on to really make academic neurosurgery as good as it can possibly be.
I would like to thank you for coming for the interview, and I hope I'm sure that we'll see a lot of development I'm going to do with the SPNS and multiple other rules. Again, thank you, and hopefully we'll see you again in the show to discuss multiple other things. This was allowed in 30 minutes, but I can imagine there are probably loads of things that we can talk about.
Thanks for asking me. Thanks for asking me, and wish you all the best with future podcasts. I'm sure you'll find some really, really interesting people across neurosurgery and beyond. Thank you.